How is everybody out there? It's Dr. Doug, and I'm going to talk to you about your heart and your brain and your brain and your heart. So start at the beginning. No one ever says you're kidneyless or you're whatever. They don't talk about your other organ system. You're liverless if you don't have emotion, if you have no love. So for millennia, we have known the heart and the brain are intimately connected. I had my first exposure to it in medical school. My dissecting partner was she was rather nervous. She got excellent grades, but she was a nervous Nellie, grinding her teeth and biting her nails. And she also had a mitral valve prolapse. One of the things that we do in medical school is we examine each other. And a mitral valve prolapse, your valves are these flapper valves, and they open and they close, and they open and they close. And so if you do this, if you do open, close, flop, that's called a prolapse. So a prolapse is an extension of tissue beyond its normal limits. And so that's when I thought, oh, that's interesting. Does the prolapse cause the anxiety? Like, is there some sort of adrenaline effect? Or is there something systemic in your whole body that causes both anxiety and both mitral valve prolapse? Or is there something in the brain telling that valve, that mitral valve, to relax too much? Who knows? The other one that's interesting is something called Takotsubo syndrome, Takotsubo. It's a Japanese term for a little leather bag or net that has a drawstring on it, and they would put bait in it and they would drop it in the water. These fishermen would, and the octopi would go inside that floppy bag. Then they would pull the drawstring up and it would be caught inside. So what would happen is during periods of intense emotional trauma, the death of a loved one, the breakup of a relationship, people will get this floppy leather bag heart, and so they will not get good pump. So we know that deep emotions can affect that. So Dr. Doug, tell me more. Why? Well, one of it is there are two things you can't change. One is your age, and the other one is your family history and genetics. So yes, there is a genetic predisposition. If you have vascular disease, if you're predisposed to that, you're going to have a little bit more heart and brain simultaneously. But why the heart affecting the brain? Why the brain affecting the heart? Well, the heart can propagate little things called clots that can lead to strokes. And we've all had that over-caffeinated sensation where we can feel our heart beating in our chest, right? That's affecting our brain. And also, if your heart does not pump well and get oxygen to the brain, things like congestive heart failure can make dementias and cognitive function worse over time. So taking care of your heart, don't smoke, don't drink, don't run with scissors. Brain to heart. So that's heart to brain. What about brain to heart? Very interesting. One of the more interesting, there's a great movie out there with Denzel Washington where he actually has a spinal cord injury. So he has a dyssynergia. So his brain and his heart are not synced, and he would have these periods of extreme cardiovascular changes. Another thing that happens is people who have had a brain injury, one, they'll release all these chemicals, but they'll also lose their little thermostat in their brain, an area called the hypothalamic pituitary axis, the HPA. And if you lose that thermostat, that hormonal and neurotransmitter thermostat, you can have cardiac changes. So another one that's interesting is seizures. It's called SUDEP, sudden unexplained death in epilepsy patients. So people can have seizures and they say, oh, it's the adrenaline or it's something else. But I think it's cardiac dysregulation consequent to the seizure itself. There's a very intimate relationship between the brain and heart. We're still working on it. I could break them all down one by one, but what you really need to know is that when you are heartless, you can have a cognitive problem. If you're brainless, you may have a broken heart. So tune in for other updates on Dr. Doug. See y'all next time. Subscribe. Save with a friend. I'll give autographs to anybody who,